Hello, guys. Welcome to another episode of Get Side. Today, we're joined by an incredible alumni who's here to share her journey and answer some of our questions about pursuing a career in pediatric psychology.
Hello, Dr. Anusha. I'm Bhumi, a second year undergraduate student at Flame University. I'm pursuing a major in finance and minoring in psychology. Firstly, it's a great pleasure to have you here. I'm sure you must know the population of people doing a major in psych at Flame University. So it's in very popular demand, and I'm sure all of us here want to know what your journey has been after graduating on at in 2016. So yes.
And yeah, I am Kushagra. I'm also majoring in psychology as well as minoring in economics. We have a lot of questions for you. We are very intrigued. And yes, we'd really love to know your journey and everything that you've been through. So, how has your journey been like since you graduated Flame as well as in Flame? How has it been?
Yeah. I can talk a little bit about my journey while I was in Flame. I definitely had a really, really fun experience. When I was here, it was still a 4 year program. And yeah, I feel like I had really wonderful training in psychology. Our faculty were incredible. I got to do a whole lot of extracurriculars, and I think I graduated with a lot of good memories for sure. After I graduated with a degree in psychology, I minored in mass communications. I went to Boston to pursue my master's in mental health counseling and behavioral medicine. Once I was done there, I moved to California for my PhD at Palo Alto University. Since I've been there, I did my residency at the Cleveland Clinic, and then I came back to California for a postdoctoral fellowship at Kaiser Permanente, and I just accepted a job at Stanford University as a faculty member where I'm going to be working as a pediatric psychologist in nephrology in their Department of Psychiatry.
Wow, that is amazing. You already have a lot of experience. You said that you minored in mass communication, right? So, what sort of relation did it have with your major, and did you like intend it to, be combined with psychology?
Yeah, I think it was pretty much an intentional choice. I think I've used things that I've learned in my communications degree throughout, especially with a lot of the writing that I've had to do
Yeah.
in graduate school. I think it definitely helped enhance my own communication skills and communicating with my coworkers, being able to work really well in a team,
Yeah.
and also just really learning about how media influences our everyday life.
Can you explain us what exactly is the difference between clinical psychology and pediatric psychology, like, and how if students or like professionals even want to pursue a specialized degree in psych, what would you recommend? Like, on what basis of interest should one choose clinical or pediatric?
Yeah. So, clinical psychology is more of a broad term to think about all the different specialties within that. So, there's neuropsychology, there's pediatric psych, there's child and adolescent psych, there's geriatrics, there's health psychology, there's assessment. There's just so much you could do within clinical psychology. So, my PhD is in clinical psychology broadly, and then I have a specialization in pediatric psychology. So, pediatric psychology is a field of psychology that's more specifically called pediatric health psychology, where you specialize in working with children with medical conditions of any kind. So, it's more of like a subspecialty within clinical psych. Um, in my day to day work, I see lots of kids with many different medical conditions. So they could be children with diabetes or with an oncology diagnosis or who've undergone some sort of solid organ transplant or blood transplant. And that's kind of where my specialty lies. I can't say that I had like a super specific vision that I knew that this is what I wanted to do, but I think going through clinical training and trying different classes and being in different clinical placements really helped me understand what my interests were and like what I wanted to specialize in because there's just so many options now.
So, what do you think is the biggest misconception people have about pediatric psychology or even clinical psychology as a broad generalization?
That's a really good question. I feel like there's a wide range of misconceptions, a lot of which I think like nowadays people are just more knowledgeable about psychology and psychologists in general. But I would say, just broadly speaking, for the mental health field, a lot of people feel like you can't go to a psychologist or a therapist unless something is really, really wrong, which might not always be the case. A lot of the training that we get is also really wellness oriented, and we're really trained to be able to help people thrive even when they're not really struggling. If you want to make small improvements in your life, I think meeting with a psychologist could be a good thing to consider if that's accessible to you.
Surely. So I'm sure most of our students, like you said, a practical experience. So if you had a chance, can you like walk us through a day in your life as a pediatric psychologist?
Yeah. Um, the thing that I love the most about the field of work that I'm in is that every single day looks different. So, a lot of my training has been within large hospital settings or large academic medical centers. So, my days typically start in the morning with like either we're rounding on all of the patients that are admitted, or I join a meeting with all of my medical colleagues where they give me updates from what happened overnight. So, like, okay, like this patient is feeling better, this person's about to be discharged, this person's going to go to surgery. So that kind of gives me an idea of like what everybody else's timeline is and what that means for my schedule. Like, okay, when can I see this person, and the other person? So I do a lot of like interdisciplinary work. So the first half of my day is usually on the inpatient medical unit. I do a lot of work in pediatric ICUs as well. So just kind of keeping an eye on the schedule, like who's going into surgery when, who's having a procedure, whose family visits at what time, so I can like have conversations with people's families and kind of get them on board. The second half of my day is usually some staff meetings for updates. I supervise a bunch of graduate students, so I usually have supervision meetings in the afternoon, then my own outpatient patients that I see later in the day, usually kind of like after school. So 2:30, 3 o'clock is when my own outpatient caseload begins.
That seems so much more interesting than like a general person would have imagined a psychologist's life to be. Like it's not monotonous as you take it. Yeah, it's like a very big misconception also that okay, if you're a psychologist, they will just go appointment, but even in the field of psychology, I feel there's a lot of experiments and exploration even when you have gained that degree and you've done all the research work at your end. Yes.
There's
Kush.
lots of options. I also have to maintain my degree, so there's a certain number of like continuing education credits. So every week we have seminars. So there's like things that I'm attending weekly to keep up with my own knowledge and like the new research that's coming out. There's a lot of time I spend reading about the field, reading new papers, updating my own education by reading books and contacting colleagues who do this work, things like that. So it's kind of never ending.
Surely.
So being someone who like you being someone who's worked with children, I'm sure it must not be the easiest thing ever, right? Because even if I imagine teachers, them working with children must be hard, especially in the field of psychology, them having limited knowledge about themselves as well as the communication barriers that exist. What would you say is like the most challenging aspect of dealing with or treating children?
Yeah. Um, I would say I really love working with children. Before I picked psychology, I always told my family that I wanted to be a teacher. So I always knew that I wanted to work with kids in some capacity, but I just didn't know what it was. Um, I don't know that it's particularly challenging in like a specific way. I think there's overall lots of challenges in working with a population that's different from you because I'm no longer a child. But I think what helps is I was also a child and I have that experience of having lived through those phases. Of course, the children that I work with have really unique medical concerns that I have no experience with. Um, the most challenging parts is navigating the system, right? Like really thinking through, are they getting this support at home? Are they getting this support at school? And kind of coordinating all of those efforts in a time limited way, I would say eats up a lot of my time and is quite challenging to do. Um, I think there's a lot of challenges in working with people from different cultures, right? Cultures that I might not be familiar with. So really approaching it with a sense of cultural humility and with a sense of curiosity to really understand each family's unique context and not making broad generalizations on what I think this should look like for this family. And really, meeting them where they are and truly helping them work through this in a way that makes sense for them and not just in a way that makes sense for me. So I think it's been a really interesting exercise in learning how to be better at perspective taking.
So, as you said that their context with at their home also matters a lot. So, what do you think are like some of the primary signs that parents, especially, should look out for for taking psychological care of the child.
Yeah. I think one of the first things that they might start to notice is that the child's routine might slightly start to change. And sometimes it might not be a big thing. Sometimes it might be their body going through like hormonal changes. So we're thinking things like changes in sleep, changes in appetite, maybe frequent changes in mood, or maybe like a lack of interest in things that they were previously interested in. Of course, there's like a range of changes within this that we would consider appropriate for their age, but we just want to keep an eye out for like how much is this changing and is this impacting their everyday activities in a significant way. So if the child's like sleeping an hour more but it's not impacting their everyday life, then maybe it's not something to be super stressed about. But if they're having a lot of trouble waking up in the morning, they're missing school, they're missing their extracurriculars, then that's something that you want to keep an eye out on and get some help.
So, as you said, there has been like a lot of practical experiences,
Mhm.
and you've explained all of those. But when you were as a student,
Mhm.
you must have had like psych is known to be about theory and a lot
Mhm.
of broad learning. But do you think it's true that it's all about just learning words and names, or is it difference? Is there a major difference between what you learn in theory and what you apply in the practical experiments?
Um, I think there's a lot of value in the theory that we learn because a lot of the therapeutic techniques are rooted in these larger, more popular theories. So I think it's definitely important to know. I don't know that you need to know each theory by name and kind of know all the specifics of it, but really understanding the application of it and why it was developed. What does the theory look like in today's world? How is it applicable? How are some parts of this outdated? Those are things I think that are really important to know. There's no way to learn that until you start using it in practice, honestly. There's like a lot of new research, but you can read about the research all you want, but really being able to apply it in real life, I think really helps solidify that learning for lots of people.
Surely. And so, like, as second year students at Flame, we have to do a summer internship program where, in our field of specification, like either in psych or whatever you're minoring or majoring in, you need to go out in the industry and experience what the work feels like. But since we're just second year students, we do not have a lot of experience on our resumes 100%. So, what do you suggest we should do to, like, know more about the field or work, like how we should build our work experience in such a field where you need like proper educational background and educational qualifications to obviously work with a major or a minor person or a client?
Yeah. um, that's the part of it that feels really challenging to navigate, right? Like, because to be able to get this position, you need to have experience, but to get this experience, you need more experience. So it's kind of hard to navigate. I would say it's worth starting with like volunteer positions or reaching out to providers who are open to having you shadow them and just observing their practice. I think there's a lot that we can learn by watching other people do this work and just get exposure to what a day in the life looks like, or what it's like to sit in a room with a client while they're talking about all of these things, or what it's even like to work in a hospital building all day or to work in a clinic all day. So I think those are things that are hard to get, even that, right? Like you have to reach out to a lot of people, but I think it's worth trying to do that. A lot of your on campus experience actually could translate. So if you're doing student clubs, if you've had a lot of like leadership experience, if you've had experience mentoring, those are all things that really add up. So the little things matter.
Surely, I'm sure all same students will be really interested in knowing how this can be applied in your life and how our clubs at Flame, like we have a psychology club, and every field has a specific club. So I think extracurriculars really add up to that, like later experience of your life. Okay, so as we talked about internships, and so in your opinion, like, do you think it's very necessary to do it in your college years, or is it okay to just like keep pursuing education but no practical experience?
I think it would really depend on your goals. Like, if you want to have a job that's clinical, kind of boots on the ground, you're meeting with clients and patients every day, I think having experience while you're in undergrad helps quite a bit. Mostly, one, like it'll help you get a job later, but two, it also helps you learn whether or not this is what you want to do, right? Like, you just don't know until you try. So, you might feel like, yeah, you know what, like I do want to be a therapist, but maybe once you try it, once you volunteer and observe, you're like, maybe this is not for me. Maybe I want to think about it a little bit more. Maybe I want to pick a different field of psychology that's maybe not so clinical. Maybe I want to do more research. Maybe I want to do HR. Maybe I want to do industrial psychology. So there's so many other options just within what you can do with the psychology degree. So I think it's just worth trying just for yourself.
There are a lot of options, and even the one that you have taken, I would say, is not the most orthodox one, right? When you're pursuing psychology. So, including pediatric psychology, what other sort of interdisciplines and just mixtures and combinations would you recommend, which are sort of upcoming and could, possibly lead to a great career?
Yeah, well, off the top of my head, the first one I'm thinking of is mental health technology, which is like obviously very up and coming. So there's a lot of really incredible like mental health platforms that are being built, mental health oriented video games, mental health apps. So there's a lot happening in the technology world. At my graduate program, there's definitely a whole bunch of people doing a lot of really cool research on using chatbots to support therapists in doing their work. So there's a lot of like artificial intelligence work into figuring out how this integrates with what we know as traditional therapy. So there's so many options just on the technology end of it. Um, Unlimited options just in the research world, right? Like if you are able to do that, that's phenomenal. On the clinical end, I would say there's still a lot of very traditional roles, but there's definitely a lot of new roles coming up, especially with like schools with like children who are gifted. That's a pretty new field. A lot of new ways of developing assessments for things that are more commonly diagnosed, like autism, like ADHD. There's a lot of work happening on how can we make these assessments more accessible, things like that. So there's a lot of options.
So as you mentioned, now I'm really interested in like using chatbots alongside. So even in our courses, we've had a lot of discussions and debates about can chatbots or can artificial intelligence really replace what a human psychologist does? But quoting your words that you use chat like professionals use chatbots to like help them in their work and not like replace them in their work.
Yeah.
So what is the like the major difference between helping or replacing a human psychologist with an AI chatbot?
Um, there's the biggest difference I think is just being able to be in person with someone and sit with them and kind of really have them have that human experience of connecting with another person. Um, AI chatbots do a really, really good job in delivering manualized treatments. So when we think of treatments for things that are really specific, like there's a therapy approach called dialectical behavioral therapy, DBT, which is a really manualized treatment. So like essentially you follow a set manual. So there's session one, you do this, session two, you do this. There's actually specific assignments. So chatbots are very efficiently able to do that and very efficiently able to support people through completing those assignments and being able to integrate that information. Um, Chatbots also are able to do a pretty good job in helping you in between sessions. So if you need like a new coping skill, you can go on ChatGPT, for example, right now and ask for one, and you actually will get very good suggestions. So there's definitely a lot of work being done just on AI chatbots in general. I think the most popular one that I've heard of, it's called Parent AI. That's also helping parents do a lot of like behavioral management stuff. So that's a big one.
Throughout your experience, would you say that there's a specific instance or a specific case which has really stuck out to you and something that you quite either resonate with or just has a special place, for you?
Yeah. There are so many families that I've worked with over the years that I think about regularly, and I'm like always wondering. I'm like, oh, like I hope they're okay. I hope they're doing well. I think in the work that I do, I usually meet families when they're experiencing some of the hardest moments of their lives, when their children's lives are at risk, when they're awaiting um, just getting a new organ for their child to survive. That's an extremely traumatic experience for most people. So I have a unique opportunity to support these families during these moments and help them overcome that and really like bring back hope and have a plan for the future. A lot of the work that I do is also bereavement and grief focused. So after losing a family member or after losing a child, I do a lot of work with families and siblings on how do we, make sense of this big loss and where do we go from here. So There's definitely lots of moments that stick with me, and I feel really, really honored that a lot of these families trust me to be able to take care of them during these times.
Previously, you also mentioned that one of the challenges that you have faced is the cultural context that is, different between you and your clients. So, how was it like studying abroad as well as treating people abroad as compared to whatever you've experienced in India?
I think it's definitely a steep learning curve once you get there. Just really being able to navigate, understanding a new education system, understanding just like small cultural things on like how you even address a professor. Like a lot of people go just by their first name; they don't expect to be addressed as Doctor so and so or like Professor. So even just learning some of those little things, I think they help a lot. I think really immersing myself in the culture helped a bit, which is because increasingly easier with social media, right? Like we're all pretty exposed to American culture.
Yeah.
When it came to more specific things about like really diverse clients that I worked with, I think my approach has always been to approach it with a lot of humility and a lot of curiosity and ask really thoughtful questions, do a lot of my own reading, but try to not make too many assumptions on what I'm walking into. Even with other Indian families that I've worked with abroad, right? Like their context is still very different from mine. So being able to identify that, yes, we might have these commonalities, but our individual experiences are still different. So I'm going to approach you and your family with a lot of openness and a lot of curiosity to just understand your perspective so I can support you in moving towards your goals, but not so much imposing my own goals on where I think you should go.
So a lot of our, like, a lot of my own peers and a lot of juniors, I'm sure, are confused that Indians still have a lot of, like, I'm very, very grateful for whatever happened after COVID and how mental health and mental awareness is so important to all of us now.
Yeah.
But there's still small stereotypes which you cannot fight as of right now. So many of like my peers are like want to go abroad and study psychology just because it's not very much, still not very acceptable in India. So what are your views about that? Do you think Indian systems or like systems abroad have changed throughout your careers, or like has there been a significant difference in those 5 6 years of education that you've gained?
Yeah, I feel like the world has changed like 10 times over since I graduated from Flame. Um, Definitely, I think every time I come back to India, like, a couple times a year or whatever, there's just so much more awareness about mental health and um, just being able to seek help. There's so many more opportunities. There's more therapists. There's access to online therapy. You can meet with people virtually, and there's like therapists integrated like within hospitals. There's so many counselors available. So I think the landscape is changing rapidly. I think more people are open to mental health services than ever before, and it's going to take some time. I think it'll take another 5 or 10 years, maybe more, for us to work significantly on the stigma that surrounds mental health. And that's okay, right? Like it takes a long time for a system to change. There's so many people that live here, and um, I think it's worth investing that time. I think there's different challenges of getting a degree abroad, right? Like your own adjustment and learning a new system. And there's a lot of benefits to it too. You get to experience a new culture, you get to live in a different part of the world, you get to travel, and you get to get an education there. So, not to say that there's not flaws within the healthcare system in other countries. So, I guess you just have to pick what is important to you and think through a lot of lifestyle factors on where you want to go to school. What does it mean for you to be away from your family and your loved ones and build a community somewhere else? There's just so many things to consider. The broader mental health landscape, I think, is changing all over the world since COVID. There's just been such a big increase in like people seeking help, but there's also such an increase in people offering support, and there's just so many more therapists just in the market. So that helps a lot.
So, and what are your key takeaways of majoring in psychology during that time at Flame University? And what are the things when you come here and when you have seen our campus and our education system, how it has changed over the years? What are the some things you wish you could experience here you could come here and experience again as a major in psychology student? Like, what would you do differently if you were here at this time?
Oof, that's a tough question. I think like the biggest takeaways. I'm someone who really enjoys being in small group settings, especially when I'm learning. So I think I really appreciated the small class sizes at the time. And I'm really grateful to be good friends with lots of people that I majored in psychology with to this day. Um, Things that I would do differently. I feel like there's just so much more access now. The campus is huge. You guys have so many new buildings that would have been really fun if they were there when we were here. Um, Also, a lot of the clubs, like we didn't have a psychology club, so that's very exciting and so interesting to me, and I'm really really glad you have that. I think also access to more faculty and just having a bigger cohort also sounds really exciting. You get to meet people from different parts of the country and different parts of the world and experience being around people with different perspectives. Sounds really fun.
Yeah.
Thank you so much, Dr. Anusha. Your insights has been really valuable. And as both of us, as well as everyone who's watching, we are all pursuing psychology. It has been a really big help. Your advice and your experience has really, hit with us. Your insights and the time that you spent with us. Thank you so much.
Thank you. Thank you for having me. It's been so much fun and truly an honor.